government to announce assistance plan for those affected by NRP. Eateries allowed to operate from 6 a.m. to 10 p.m. Hello there, welcome to News at 10 with me, Brenda Paul. The government will announce either tomorrow or Tuesday a more comprehensive form of assistance for various groups in the country affected by Phase 1 of movement control under the National Recovery Plan to curb the spread of COVID-19. Now, Prime Minister Tan Sri Muhyiddin Yassin said he would announce the details of the assistance, including for small and medium enterprises, SMEs.
Memberi apa-apa bentuk sokongan, support yang ada kepada seluruh kumpulan masyarakat yang dalam kes begini hampir lebih 12 juta atau lebih daripada itu individu yang terkesan isi rumah yang terkesan akan terus dibantu, dan mungkin ada kes-kes peningkatan bantuan-bantuan yang akan disampaikan, termasuk lagi bentuk-bentuk lain untuk SME dan sebagainya yang detailnya akan saya umumkan pada hari esok ataupun lusa, insyaAllah.
The Premier added that he is aware that everyone is waiting to see how the government is going to help those affected during this phase of National Recovery Plan and subsequent phases until the end of the year. He also noted that there will be assistance for B40, M40 and loan moratorium for the T20 eligible group. Tan Sri Muhyiddin also said that what is important is that support is given to all groups in society.
On another note, Tan Sri Muhyiddin said the Phase 1 of movement control under the National Recovery Plan, PPN, which is scheduled to end tomorrow, will be extended. He said Phase 1 has to be extended as the number of COVID-19 cases in the country has not dipped below the threshold value of 4,000 required to move to the next phase.
Bahawa mereka kata sekarang ni dah nak tamat PKP dan sebagainya. Tapi saya kata mulai sekarang ni kita tak sebut PKP ke tak PKP, kita sebut kita berada di fasa. Sekarang ni ialah fasa pertama, dan fasa pertama ni akan kita lanjutkan sehingga mana kita telah mencecah nilai ambang. Threshold bawah 4,000, kes di ICU sudah turun daripada paras yang agak tenat. Kemudian tu masalah vaksinasi dikatkan.
Tan Sri Muhyiddin added that Phase 1 was to test the country's resilience so that it could go through all the PPN phases smoothly. On 15 June, the Premier announced the PPN, which has 4 phases that will transition in stages. The government has today announced a revision to the existing operating hours for eateries and restaurants under the first phase of the National Recovery Plan, NRP, to operate from 6 a.m. until 10 p.m. starting tomorrow. Senior Minister for Security, Datuk Sri Ismail Sabri Yaakob, said, however, dine-ins limited to 2 people per table will still be restricted to the third phase of the NRP.
Commenting further through a statement release, Datuk Sri Ismail Sabri said after taking into consideration the appeals and views from stakeholders, today's meeting has agreed to revise the operating hours from 6 a.m. to 10 p.m. effective 28 June. Earlier today, Prime Minister Tan Sri Muhyiddin Yassin said the first phase of the NRP due to expire tomorrow will be extended as the country's COVID-19 infection numbers have not met the threshold set. Malaysia would not be able to exit Phase 1 to Phase 2 until all 3 NRP indicators, new cases below 4,000 daily, moderate demand on intensive care capacity and 10% vaccination in the country have been met. Following the extension announcement to Phase 1, Datuk Sri Ismail Sabri said existing standard operating procedures, SOP, are still in effect, whereby all non-essential economic and social activities are not allowed to operate except those listed under the approved list stipulated by the National Security Council.
The government will reintroduce the initiatives that have been implemented previously to assist the people in line with the implementation of the National Recovery Plan, NRP. Finance Minister Tengku Datuk Sri Zafrul Abdul Aziz said the government has not stopped to continuously help the people and is always striving to think of solutions for this purpose.
Elaborating further on the matter through a Facebook post, Tengku Datuk Sri Zafrul said with the NRP, this is the right time for the government to bring back such initiatives to help the people and businesses. He said he had already discussed this matter with the Employees Provident Fund, EPF, and Bank Negara Malaysia, BNM. Tengku Datuk Sri Zafrul reminisced the events that unfolded last year when the government, for the first time in history, introduced the I Lestari, I Sina, an automatic moratorium to assist the people in facing the challenges brought on by the COVID-19 pandemic. He said Malaysia were among the first few countries in the world to introduce such initiatives. He added that initially, many opposed the program. However, later on, there were among them who acknowledged the positive effects of the initiatives on the people and started to support the program.
5,586 new COVID-19 infections were registered today, taking the country's cumulative cases to 734,048 since the beginning of the pandemic. Now, Health Director General Tan Sri Dr. Nur Hisham Abdullah in a statement said of the new cases, only 3 were imported, while the rest are local transmissions.
Selangor registered 2,212 positive cases today, followed by Kuala Lumpur and Sarawak. Each recorded 628 and 513 new infections respectively. Tan Sri Dr. Nur Hisham also reported 4,777 new recoveries in the last 24 hours, pushing total patients recovered from the deadly virus since the pandemic began to 667,709. There are 61,395 active cases currently receiving treatments nationwide, with 886 being treated in the ICU and 446 patients requiring breathing support. 60 new deaths reported as of noon today, and the country's death toll rises to 4,944.
187,877 COVID-19 vaccine doses were administered yesterday, taking Malaysia's cumulative distributed jabs to 7,226,949. In a Twitter post by Health Minister Datuk Sri Dr. Adam Baber, from the figure, a total of 132,279 individuals received their first shot yesterday, and 55,598 others had completed both doses.
Datuk Sri Dr. Adam added, as of yesterday, there are 5,204,993 recipients of the first dose and 2,021,956 individuals who received their second dose injection. Selangor continues to record the highest number of recipients who completed both doses, with 268,730. This was followed by Sarawak at 212,978, Johor 211,797, Perak 187,852, and Kuala Lumpur 170,621.
The Women, Family and Community Development Ministry has recommended that women who give birth in hospitals are to be given the COVID-19 vaccine before they are discharged. Its Minister, Datuk Sri Rina Mohamad Harun, said the move was to make it easier for them to get the vaccine, which should be administered on advice from experts.
Sebenarnya, golongan ibu yang mengandung ini juga mempunyai risiko yang tinggi sekiranya dibandingkan dengan golongan dewasa yang lain. Jadi pemberian vaksin ini sudah pastinya dapat membantu ibu-ibu. Dia bukan sahaja ibu tetapi anak dalam kandungannya juga.
According to Datuk Sri Rina, nearly 110,000 pregnant women have registered for the COVID-19 vaccination through MySejahtera, and to date, 11,000 of them have been given their appointment dates. Meanwhile, she also suggested for babysitters to be given the vaccination at 49 Nur Sejahtera clinics. On the vaccination for people with disabilities, PWDs, the minister said registration involving the group was still low, with only 280,000 individuals having registered for the national COVID-19 immunization program. She said the ministry was also in discussions with e-hailing companies to help provide transport for the PWDs to the vaccination centres, PPV. A drive-through PPV for the PWDs has been set up at Menara Saim Darby Plantation in Ara Damansara, adding that the ministry would also set up similar facilities in other states for the group.
Wearing a face mask plays a vital role in protecting ourselves from COVID-19, but we can enhance that further by washing our hands regularly with soap and water. Now, this is because the virus may be transmitted to us and everyone else by touching on surrounding objects, especially in public areas. Now, to further delve into the importance of washing hands with soap, let's hear what reporter Erwin Zayed from Johor brought for us.
Medical and emergency expert at KPJ Johor Specialist Hospital, Professor Dr. Rashidi Ahmad said the virus indirectly spreads at an alarming rate since COVID-19 can remain active for more than 4 hours on an object's surface. Therefore, people need to be aware of their surroundings and practice washing their hands with soap as well as avoiding touching their face when in public areas.
Yang satu lagi secara tidak terus. Jadi contohnya ada seorang tu ada penyakit COVID-19, dia pun batuk ataupun bersin, virus tu jatuh atas meja contoh. Jadi bila seseorang tu datang, contohnya seorang datang, dia tak tahu dekat atas meja ni ada virus, dia pun letaklah tangan dia kan. Lepas dia letak tangan dia, gatal pula lah hidung kan. Gitu-gitu, maka virus pun akan masuk ke dalam salur pernafasan orang itu, maka dia akan mendapat jangkitan COVID-19.
He also emphasized that washing hands with soap is more effective than using hand sanitizer alone in terms of eliminating the virus.
Kita pun tak tahu di mana COVID ni berada. Mungkin di depan kita, di sisi kiri kita ataupun depan-depan kawan kita. Jadi apa yang perlu kita nak elakkan, antara cara nak elakkan ialah kita menjaga kebersihan kita.
Saya sendiri sentiasa basuh tangan untuk mulanya aktiviti dan tamatnya aktiviti. Bukan kerana COVID-19 sajalah. Maksudnya sebelum ni pun kita memang dah amalkan benda perkara macam tu. Tapi bila sekarang ni dengan pandemik COVID-19 yang sangat meluas ni, saya rasa sangat-sangat perlu untuk kita jaga kebersihan diri kita sendiri. Maksudnya basuh tangan tu adalah sangat penting sebelum dan selepas aktiviti.
Saudara-saudara yang duduk di rumah kita kan, supaya mengamalkan kebersihan dan mengingatkan mereka supaya sentiasa basuh tangan dan jagalah diri kita, sebab penyakit ni kita tak tentu bila-bila masa yang kita akan terkena.
As we know, we cannot see COVID-19 with our naked eyes. Therefore, we need to always be aware of our surroundings. For instance, this table right here. We do not know who coughed or sneezed on this table before this. So if I touch this table and then I proceed to touch my face, the virus may spread. Therefore, we need to wash our hand with soap in order to prevent the spread of COVID-19. Erwin Zayed, reporting for RTM News.
Coming up, government mulls hybrid parliament seating. Stay with us. A hybrid parliament sitting may be chosen should the physical one could not be implemented. However, Minister in the Prime Minister Department for Parliament and Law, Datuk Sri Taqiyuddin Hassan, said the government has yet to decide on which method would be used.
Parlimen mencadangkan kalau tidak boleh dibuat secara fizikal dan kalau kerajaan putuskan untuk adakan sidang parlimen, pilihannya hybrid. Jadi untuk hybrid tu dua-dua speaker pun dah beritahu dah ada banyak perkara yang perlu diselesaikan.
Datuk Sri Takuyuddin said the Prime Minister will decide on the Parliament sitting date after consulting the Attorney General. The matter will then be brought to the Yang di-Pertua Dewan Rakyat before issuing a 28 days notice to the Members of Parliament as stipulated. So far, no such notice had been issued due to the ongoing emergency ordinance, which is expected to be lifted in August.
A man was shot dead after injuring a policeman with machete. Now, the man, who is a suspect in a criminal case, was shot by the police in a raid at a farm in Air Terjun Bayan Lepas, Pulau Pinang. Berita RTM Police Chief Superintendent Kamarul Rizal Jenal said the suspect, who is a local and unemployed, had 22 previous records and was wanted for several cases, including house break-ins and theft, reported in the Berita RTM district. He said the raid was conducted at about 3:30 a.m. after the police received a tip-off on the whereabouts of the 34-year-old man.
Pegawai tim serbuan sampai di tempat kejadian. Tiba-tiba suspek telah melompat daripada kawasan hutan ni dan terus menyerang anggota kami. Salah seorang daripada anggota saya telah menjerit polis dan suspek masih lagi terus menyerang anggota saya sehingga menyebabkan salah seorang anggota saya terpaksa melepaskan 2 das tembakan bagi mempertahankan diri. Setelah melihat suspek rebah, pihak anggota saya telah menghubungi ambulan bagi membantu menyelamatkan suspek. Namun begitu, hasil pemeriksaan pegawai kesihatan di tempat kejadian telah mendapati suspek telah meninggal dunia di lokasi ini.
Police seized and confiscated a machete used by the suspect, a screwdriver, and an apparatus for drug abuse. Over 100 kilograms of methamphetamine drugs worth 6.439 million ringgit were seized by the police in a car at a Gopeng Toll Plaza roadblock last Wednesday. Now, Perak Police Chief Datuk Mio Fadil Atras Wahid said 2 men were detained.
Datuk Mio said the suspects, aged 41 and 47, were travelling in a Bentley car when they were stopped at the roadblock at about 7:30 p.m.
So, hasil daripada pemeriksaan tersebut kita telah jumpa tadi 117 bungkusan teh Cina yang di dalamnya mengandungi 122.5 kilogram dadah yang kita syaki sebagai dadah jenis metafetamin. So, ekoran daripada itu, kita telah bawa dua lelaki Cina bersama dengan kenderaan yang kita cerita tadi ke IPD Kampar, dan pemeriksaan lanjut telah jalankan. Kita jumpa lagi 6 bungkusan teh Cina yang di dalamnya mengandungi 6.28 kilogram yang disimpan di ruang penyimpanan tayar, spare tayar.
He said the police also seized 3,390 ringgit in cash from the suspects, who were found to be travelling with an expired interstate travel permit. The 41-year-old suspect tested positive for methamphetamine, while the other was found to have 4 previous criminal records. Both of the suspects, who are from Johor, are in remand until 30th of June to facilitate investigations.
Wrapping up today's edition of News at 10, in our top story, government to announce assistance plan for those affected by NRP. Do join us again tomorrow afternoon for the updates at noon at 12:30 p.m. Till then, I'm Brenda Lepal. Stay tuned to Saluran Berita RTM. Stay safe and good night.